All right, Dr. Mary here. In this video, we're going to talk about thermography. I just have been here getting thermal imaging. Gina's going to talk a little bit about her background, what thermography is, and tell you a little bit why it's beneficial for women and probably men to get thermography.
Thank you. My name is Gina Berry, and I'm with Florida Medical Thermography. We are located in Florida, and we have 40 plus clinics throughout the state, from Jacksonville up to Ocala to Sebring, Sarasota, across Central Florida, and today we are in Plant City. So thermography is infrared imaging. The camera, which is over here, we use the best camera, FLIR camera, that captures the skin surface temperature of the body, which is your largest organ. Now we do a number of types of imaging. We do breast imaging, we do a health study, which is what she was talking about, from a half body. That's from the head to the abdomen. That includes head and neck, dental, carotid arteries, thyroid area, chest, heart, and lungs, the abdomen and the back, and we also do full body imaging. The client is actually either sitting or standing for their imaging. There is no radiation, there's no compression. The images,
which is a big deal. You know why women don't like mammography.
That is true. We're not allowed to tell you not
I
to
will
have,
tell you. I
yeah,
will tell you.
We're not allowed to tell you not to have a mammogram, but there are a number of things out there that if you'd like to educate yourself on, there's a video called Boobs, the War on Women's Breast. It's a documentary about an hour and a half long. And then there's one that is, I can't think of it. Anyways, that's a really good one, and I would encourage you to listen to that. But they explain what they see, the science, a panel of doctors, they see what the science says about mammograms, and then their recommendation for checking the health of your body, being proactive before something manifests itself, would be thermography paired with breast ultrasound when it comes specifically to the breast. But again, there's no radiation, there's no compression. It's as simple as sitting before a camera or standing. And then the images are uploaded. We do a medical intake of whatever areas that we are imaging. And then the images go to our interpreting services, which is Physician's Insight. And we use Dr. Christine Horner as our interpreter. She was a breast surgeon. She's an Ayurvedic practitioner now, and she's learned how to do the measurements. Temperature differentials is what we're looking for. She can recognize unusual vascular patterns. She correlates that with history, and then you get a report sent to you.
And so part of that too is that's what we're looking for, is a lot of times vascular differences, because, can I say this?
Sure.
When cancer grows, it needs vascular support. So in breast studies, a lot of times, as I was taught, and you can correct me here, is that you'll get a baseline thermography, and then so many months later go back and get checked again to see if there is any vascular changes, because they might be, thermography may see an area that's a problem, possibly a problem, years before mammography would see that. Is that correct?
Yes. Now, thermography is not a diagnostic tool, but as we know, and as Dr. Mary was stating, all disease starts with inflammation.
Yes.
Thank goodness not all inflammation leads to a disease. So you have this spectrum of where you can be proactive and work on things. So any cancer or tumor, it does need a vascular feed to be problematic. So we can see those slight changes. Although we do not diagnose something as cancer, we can see where there's unusual patterns that you have an opportunity to begin to get your body back into balance. So because when your body's balanced, it can't have the disease process. So yes, it's an early look. We like to say heal before you can feel something. We don't want something to manifest. So this gives you opportunity to look at that and to work with practitioners such as Dr. Mary or other practitioners that have more of a holistic mindset in healing the body and realizing that it's really all things, mind, body, and spirit. We're not just our breast, we're not just our heart, we're all of those things. And so kind of put those together into perspective so that we can work on being healthy.
What exam should someone pick? So I know we looked today at my carotid arteries, right? Or the neck, the thyroid, the abdomen. I saw a little something with my unhappy liver on there, or gallbladder, I don't know. But that correlates a little bit to what one of my last exams and blood work, so that makes sense. But how does someone decide what they want to get looked at, or what would you recommend?
What you did today is called a health study, and if you're not having any challenges with your legs and your feet and your arms and hands, it's a great way because it's covering all systems, head and neck, kind of the chest.
Dental, yeah.
We have a lot of holistic dentists who now refer folks to come our way so that they can see if there's any inflammation in the jawline without getting x-rays. And so that's
I would say anyone who's had a root canal needs thermography.
Exactly.
Yeah.
So the health study is a good way to look at all things because, like I said, we're not just, as women, we're not just our breasts. There's a lot of things going on. There could be dental issues that are affecting.
Say that, please, because dental issues do affect the breast. People don't realize this.
And it affects the heart.
Yes.
So there's a lot of things so the health study would be the recommendation. Our website, FloridaMedicalThermography.com. It lists the services that we offer, the locations that we are in, and most of the clinics you can schedule online yourself, make your own appointment. There's a few of them that you would call directly the clinic, and they set up our schedule for us.
Wonderful.
And so there's a lot of articles and information on our website. There's a Q&A, so there's any number of things, and you certainly can reach out to me and call me. I'll give you my personal cell phone number. It's 863-860-4769. I'm happy to either help you set an appointment or answer any questions that I can, or point you in the direction to find the correct answer.
Thank you so much, Gina. One more time of what the website is again.
It's FloridaMedicalThermography.com. So
FloridaMedicalThermography.com.
And you spell them all the words out.
Thank you so much.
Thank you.